No more stomach cancer. The stomach is a part of the digestive system. The stomach secretes gastric acid to help digestion, grinds large pieces of food into small pieces, and then gradually transfers the food into the intestines through intestinal peristalsis to continue the digestive process. Gastric cancer occurs when cells in the stomach mutate and develop into malignant tumors. Genetic mutations in gastric tissue cells turn normal cells into cancer cells. There are many factors that cause gastric cancer. Studies have found that Helicobacter pylori and Epstein-Barr virus infection may increase the chance of gastric cancer. Please pay special attention to the following people. 1. Gender. Men are twice as likely to develop stomach cancer as women. 2. Age. The older you are, the higher your chance of developing gastric cancer. The chance of developing gastric cancer is higher after the age of 50. 3. Diet. Long-term consumption of high salt, pickled and smoked foods will increase the risk of gastric cancer. 4. Diseases. People with gastric polyps, those who have undergone gastrectomy surgery, and those with pernicious anemia have a higher chance of developing gastric cancer. 5. Smoking. Smokers are more likely to develop gastric cancer than non-smokers. 6. Heredity. People whose close relatives have suffered from gastric cancer are more than twice as likely to develop gastric cancer than other people. In terms of diet, general anti-cancer dietary principles can be adopted, including 1. Eat more fresh fruits and vegetables. Cruciferous vegetables contain anti-carcinogens, which can help decompose carcinogens in the body. Fruits and vegetables rich in carotene and foods rich in vitamin C can help strengthen the body's resistance and directly reduce the chance of cancer. 2. Eat less high salt and fried foods. Pickled, smoked and grilled foods such as sausages, salted eggs, sausages, ham, bacon, salted fish, etc. form carcinogenic compounds during the production process. Fried food will produce free radicals during the frying process, which will reduce the oxygen content of tissues in the body and damage the tissues of the body. 3. Pay attention to personal hygiene. Wash hands frequently and avoid contact with excrement or vomit to avoid Helicobacter pylori infection. 4. Regular examination. If a close relative has suffered from gastric cancer, it is recommended that people over 40 years old undergo regular gastroscopy every year. If you have the following symptoms, you may have gastric cancer, but it may also be other more common conditions such as gastritis, gastric or duodenal ulcers. If you have any suspected symptoms, you should consult your family doctor as soon as possible. Persistent indigestion and loss of appetite, rapid weight loss, swelling of the lower abdomen, abdominal distension and discomfort after eating, vomiting, or even vomiting of blood, bleeding or black stool, anemia, fatigue, and weakness.